everyone, my name is Antonia and I have prepared a presentation about the atrial fibrillation. So heart is the center of our cardiovascular system, pumping blood in our organism and thus delivering oxygen to tissues in organism. Heart has extrinsic control functioning based on sympathetic and parasympathetic nervous systems and intrinsic control within itself as electrical signals. The intrinsic control is a self-propagation of our heart to work independently from other body parts, allowing our heart keep working even if the brain is damaged. The heart creates electrical stimuli leading to resting and contraction phases, also called as diastole and systole, through polarization and depolarization. SA node is leaky to sodium cations, which allows for self-excitation and slower developing action potential through less negative resting membrane potential of about negative 60 millivolts and inactivating sodium channels. While calcium channels open and flows inside from the extracellular fluid, depolarization occurs. And this is how our heart is able to contract and relax through electrical stimuli. So electrical work and activity of our heart can be captured on the ECG, allowing for examination of electrical pathways and potential enlargement of our heart. In ECG, the bottom correlates to time and peaks to the electrical activity. And peak to peak is 1 heartbeat, which is about 0.8 seconds. Electrical stimuli go from the pacemaker with highest degree of inherent rhythm, which is the sinoatrial or SA node in superior lateral wall of the right atrium, visible on the ECG as the P wave, and progresses through atrial myocardium at 0.3 meters per second, and to the node or to the other node, to the AV node, at 1 meter per second, where this delay allows for filling ventricles with blood. On the PQ segment representing, on the ECG, the PQ segment represents signal conducting from SA to VA node when atrial systole begins, and the PR interval signals conduction through the AV node before ventricles are activated. From VA node, the excitation spreads down the AV bundle via Purkinje fibers to ventricles at about 1.5 to 4 meters per second. A subendochondrial network conducts excitation through ventricle myocardium. QRS interval on ECG represent ventricle depolarization. ST segment is the plateau phase where ventricle depolarization and systole occurs, but there is not contraction or activity. At the T wave, ventricles repolarize and blood is pumped. The peak QRS complex is where the ventricles are depolarized. QT intervals get shorter during exercise and they represent the duration of ventricular depolarization. So I have just described what's the ECG, and now I'm going to talk a little bit about the atrial fibrillation, which is a disease which can be assessed and monitored by the ECG. So atrial fibrillation is a multifactorial arrhythmia, which is the most common clinical arrhythmia that causes severe adverse cardiovascular events such as ischemic stroke and acute heart failure. Ectopic sources that initiate this disease triggers from the pulmonary vein. Fibrosis refers to the increased deposition of extracellular matrix protein in the myocardial interstitial tissue due to excessive proliferation of fibroblasts in response to pathological condition. Age, body mass index, height, hypertension, diabetes mellitus, obstructive sleep apnea, myocardial infarction, heart failure, smoking, and genetic predispositions are risk factors for developing this disease. Cardiac adaptations to exercise can be beneficial, but with vigorous physical activity and prolonged endurance exercise, this may lead to cardiac overadaptation or even maladaptation and pathophysiological changes, which facilitates development of this disease and initiation and perpetuation of atrial fibrillation and other diseases arising from this disease. AF rates with people suffering from this disease increase globally every year, and within the last 50 years, it was threefold increased. There is usually it's about 2% in general population who suffer from this disease, and it's about 10 to 12% in the people who are 80 years old or older. The development of atrial fibrillation is associated with the electrical and structural remodeling of the atrial tissue. Detection of this disease requires a long period of ECG monitoring using the external devices or implantable devices. PR intervals and it indicates and represent atrial and atrioventricular condition, and therefore can be used to assess the association between pathological PR interval, where irregularity of PR interval and the absence of P waves appear as sawtooth patterning, hiding clear P waves in AF, and this can we see on pictures on the right side. So nowadays, we use ECG and log monitoring for assessing this disease, but also we use artificial intelligence for assessing if someone is suffering with atrial fibrillation. And also in AF, as we can see on the ECG on the right, there are a lot of small contractions that look like the heart is fibrillating, but it's because we are missing the P waves. So prevention and healthy lifestyle are very important for trying to get away from this disease. But when we already have this disease, it can be treated with drugs, though there were tests and it was shown that in the catheter ablation versus anti-arrhythmic drug therapy for this disease, the catheter ablation group had superior quality of life compared to the anti-arrhythmic drug groups and less atrial fibrillation recurrence after blanking through intention to treat analysis. So catheter ablation of this disease is currently recommended as the first-line therapy of anti-arrhythmic agents, which prevents from failing to maintain sinus rhythm and is considered as an efficient non-pharmacological therapy. This disease is also associated with increased mortality, not because of itself, but because patients do not die, but because patients suffer from associated health problems such as heart failure, myocardial infarction, chronic kidney disease, venous thromboembolism, stroke, dementia, and cancer, And for people who suffer with atrial fibrillation, it's very important to keep monitoring ECG and the most and wear the and use the catheter, because it was shown that it's better for people with compared to the drugs. Thank you for watching. These are more sources.